as a result of implementing these? Anybody?
Actually, roles have come down. See,
but the balance of the roles
Yeah.
have changed. The value you attach to different roles, what you call in chemistry as the balance, the weightage, that seems to be going differently. In the sense, roles which were not particularly valued earlier, the MIS role, for instance, has become a lot more valued in organizations. You know, after what he talks about drowning in data syndrome, increasingly changing in organizations where information seems to be happening a lot more, and companies succeed because of information being available at the right place at the right time. The data structures getting reorganized. So people who, for instance, are in-house MIS people are becoming more powerful today in the organizations, which earlier used to be kind of, just kept in the periphery or whatever. They become more central. The idea of line and staff are changing in organizations. No longer the line is the boss. Maybe manufacturing still there's a certain element of legacy still, but many organizations today, line staff distinction is vanishing.
I agree. More and more organizations are now becoming matrixed.
That's right.
From clear-cut black and white roles,
right.
roles are diffusing, between each other.
Yeah.
A project manager is no longer a project manager; is a program manager.
right.
He don't look at things internally.
Yeah.
He looks more at multiple alliance partners and vendors and suppliers coming together and a new solution emerging out of the amalgamation of all the inputs into, so he ends up coordinating much more, and I, I've seen in my experience, most highly paid jobs are now becoming program management jobs, than traditionally sales jobs or, or finance jobs, which used to be, traditional. But yes, this diffusion is definitely happening.
actually, the silos are broken actually.
Yeah.
Today,
Silos.
you find more dotted lines
Yes.
reporting than the straight line reporting. And so we could do a lot of concurrent work, and multifunctional teams could come together because of technology. We share the same platform, the right inputs come from various places. And so we find that the roles actually, number of roles have come down, but the depth has gone up. The people could access information at different functions. So earlier, a finance fellow can't get what is the sales. He just talk to somebody and get it.
Yeah.
Today, my designer can know what the orders likely to come. So today, it's more transparent, more integrated. So I think actually the number of roles have really come down, whereas the depth of the roles have gone up. So I find people are more informed. I could take a lot of considered decisions.
Yeah.
I mean, that's really
Another thing which I have just, experienced in the last few years, and I met some customers, and they, people have been working, you talked about high touch and high tech, but I give an example. I met this, global procurement head from IBM, and he works from home for last 25 years. Wow. He's a 26-year-old employee of IBM, and he says, I've been working from home for last 25 years. So my boss was with me and we were discussing about some topic, and a name came during that discussion. Yeah, I know him, but I've never seen him. We've been working together in IBM for the last 25 years. I recognize his voice, but I have never seen him. So technology is also leading to, a different scenario, that where, and you might say it is not a high touch scenario, but but
Depends on how the guy
Is that
looks.
is it a good development?
sorry.
Is that a good development?
So I would say that from the individual perspective, now it might change from person to person. I would say that somebody who's a in-house parent still wants to work, works at his own pace, at his own time, with a very flexible scenario, is able to prolong his career, his or her career for so many years. Otherwise, maybe there were certain circumstances he or she would not have been able to work that way, and technology enables it for him. And more and more. Avinash gave an example of Airtel where we said, okay, come anytime, come, work from home. But I've seen, certain organizations who started this, way back, Now, maybe in a manufacturing scenario, it is a completely non-acceptable kind of a piece because you have to be in the factory and, have to be around the place.
The other part is in India,
Yeah.
Working from home, I think there are studies to show that there is a social stigma attached to it.
Yeah.
The neighbor's wife starts believing is your husband really working, or the
Yeah,
neighbor's
I
wife believes that this person really working. So that's one operational challenge, cultural challenge which technology cannot overcome in India. Whereas when I talk to friends in the US, they say, where do you work from? From my pajamas. Yeah. What stupid question are you asking? So that's the way they work from home. They're used to working at home for 5, 6, 7, 8 years.
Yeah.
you
No,
know-
I've heard comments, I can't come on video, I have not shaved today. The guy's working, he's on the calls, he might be spending 10 hours on the day, but he's decided not to take a bath that day. But he doesn't want to come on.
Strangest of problems.
I have
Of
a
course,
point. When you change to technology, we also need, now all of you are from the private concern where you can hire and fire at will. Whereas in a government firm, when I changed from memory card to wireless technology, GPRS modem, I don't have IT people to manage the 3 lease lines, servers 24/7. And I have every minute data pouring in from all over India.
Sir, you need us,
Cargill
we
to-
will manage it for you.
No, I'm able to pay the salaries from within my budget, but creation of post is not in my hands.
Yeah, I know.
It's the government of India. So it has to go to finance ministry and the file will be lying there. I'm sorry, don't record.
No, that's I like the word high tech.
No, I'm saying there are peculiar problems when you push in new technology in these kind of sectors. You need to have a cell which will manage the technology efficiently. The person who is knowing to handle the technology should be there. Otherwise, we are ending
The,
with
the hand-holding
inefficiency.
process. I know. When we're talking about high tech and high touch, I mean, Dr. Sharma, Dr. Badrinath, I mean, in the world of healthcare, I would assume that the importance of touch is as important as technology. How are you managing? I mean, how has been the reception of newer technologies, not just by the practitioners, but also by the people who are your patients at the end of the day?
Well, the technology has permeated healthcare like anything. For example, just to give you a little example, this is an eye, and inside the eye is a hollow cavity, and it's filled with a gel. And the diseases which involve the back part of the eye and this gel, and that is what the specialization is. When I started, and the surgery is known as, the name of the gel is known as vitreous humor, you must have heard in your school.
Yeah.
And the procedure is known as vitrectomy, right? The number of cuts, when I started doing vitreous surgery, I was trained by Dr. Badrinath in 1985. The cuts were only 800 per minute. And today, it has become 5,000. We started doing, when you say technology, we had instrumentation which was 20 gauge, less than 1 millimeter, 0.89 millimeter. And now it has moved from 20 gauge to 23 gauge, from 23 gauge to 25 gauge, and next few years becoming 27 gauge. So we don't have to really suture the wound. It's become a sutureless surgery. Not only the instrumentation have changed the scenario, but also the scientific advancement, the way you fashion the wound, you don't have to suture those wounds. It really goes in terms of surgical precision, less complication, and more control. And of course, efficiency was the theme today in terms of patient's enhancement and visual improvement.
Dr. Badrinath, how is the cultural reception of these technologies?
There are rapid advances, and I must say that they have given advantage, such as what Dr. Tarun Sharma mentioned just now. I think our stream looks at what we can do with the availability of the technology brought to us by various groups, engineers, etc. So I think from that point of view, actual innovation, invention, manufacture of a particular tool is not going to be by us. But we do provide very important information for the person to work on. So I think I would say both in the diagnostic field as well as in the therapeutic field in medicine, rapid advances has taken place, and most often, unfortunately, we don't keep pace with it, but we are informed about it by various sources.
Okay, I'd like to come to,
Actually,
yeah.
to us, these advances in technology in healthcare, we look at it as a double-edged weapon.
Mhm.
Is it a boon or a ban? The advances, as Professor Badrinath was pointing out, it really helps to save lives, to diagnose critical things, but the misuse of these advances, the brunt is borne by the insurance companies. The healthcare cost with these advances has drastically grown up. This is because sir was talking about high touch. There is no touch by doctors now. There is no clinical assessment. Patients are subject to investigations of different sorts and high-end equipments. The investment on such equipments warrants sending several patients to do unnecessary scans. No, it is not the matter of paying money for such patients. They are also exposed to radiations. The drawbacks of this technology in healthcare, it's as the technology is advancing, there should also be control measures. And the indications should be really justifiable.
Question of regulatory measures. I have a couple of minutes before I close in, but I'd like to bring Avinash and Kishore in on this. When you're looking at deploying solutions, the question of vendors comes in, and this was something Mr. Pandirajan and Mr. Shamsundar spoke about. Have one vendor or multiple vendors, you chop the processes and you delegate the work. What are the arguments, or what are the trends that you both are witnessing, within the industry? Are people going towards a single vendor who's a jack of many trades, or are people, cutting the processes up and going to individual masters of individual trades and individual expertises? What's the combination? What works? What doesn't work? The cases for both of them.
Yeah. So traditionally, it's always been somebody is the master of a piece of the technology, or the expertise is there in a niche area. Unfortunately, in technology piece, it still continues that way. But with the advent of the service model coming in, think about Airtel outsourcing the entire network to Ericsson or Nokia. I don't care whether the building owner will give you permission or not. Put the tower there, put the equipment there. Power is your issue. Give me the network. I want to use it, and this is the SLA you need to deliver me. And basis the SLA, I'll pay you, which is the revenue share from my revenue, right? I'll share my revenue with you against the services given. Now, these are the new models which have come up, where experts still remain where they are. I will take those services, but become a one-window solution for you. And hence, I will deliver a service what you are expecting me to deliver. Another thing which is very crucial, and I'm sure as leaders of your organization, you face it on a daily basis. You talked about capital productivity, right? Huge amount of investment has already been made, right? I'm coming with a new solution. You are not going to, write off that investment which you did a couple of years back or 3 years back, and still there is some, amortization left. What you're looking at is an incremental change, right? I don't want to waste my investment. Give me efficiency, what you're talking about, with incremental investment, and that incremental cost gives me incremental business benefit without changing my entire investments, right? So I think these two trends are emerging very, very rapidly. Most of the solutions which today service providers like us offer are with incremental investments and incremental change. Almost always these are service-based models, because traditionally, if you talk about telcos, we've been allowing you to use first and then pay later, right? So that's ingrained in us. Okay, that business model works with us. BSNL for last so many years have been doing it. When we came into it, you use it for the whole month, we produce a bill, you verify it, and then you pay it 30 days later, right? So that model works. That means the culture is of investment, investing it first, and then expecting the benefit will come. That is allowing us to make those incremental solutions available to our customers, bringing in the partners at the back end. So today, if you ask me, I'm giving you telecom service, but the entire IT is managed by IBM, entire network is managed by likes of Nokia and Ericsson. Now other 4G and 3G companies are coming in and enabling those services. But you use a Hello Tune, you download a music, you use a video conferencing service, there is a partner behind me which is enabling this service. They have invested along with me in that platform. When you use video conference service from me, it is a Polycom and Cisco's of the world who's working at the back end with me to enable that service. There is a BPO partner, there is a service partner, there is an integration partner which is coming and playing that role. But what you are looking at today is that, okay, give me this service, I'll pay you 5 rupees a minute for VC, right? Or it's an audio conference and I'll pay you, 1 rupee a minute, and I want to bring so many people on the bridge. You want to do a earnings call with your investors, and you are expecting that, okay, 1,000 people are going to log into that bridge. Where do I go? I do not have that infrastructure. Is there a service provider available which can enable this for me? Yes. That is possible. Theoretically, you can bring in 10,000 people logging into the same bridge, moderated by a moderator, and you can do an earnings call, one-way, two-way, interactive, question answer, all that. So it's amalgamation of various experts coming together and giving one service with an SLA, which always works.
That's the preferred choice.
Sorry?
That's the preferred choice.
Yeah.
Instead of dealing with multiple service providers, as a user of service,
Absolutely.
you'd be happy dealing
You'll have to keep
single
10
window.
people to manage those service providers itself,
Exactly.
right? If you don't do that.
So, Ashwin, my view is that there's a spectrum of, we talked about rapid change in technology. And I think the one cannot really measure the amount of change is really happening. Every day there is a startup coming up. Every day Google comes up with a new concept, Cisco comes up with a newer concept. There's a spectrum between the startup and the established player. Both sides there are ideation happening, innovation happening. One comes from great R&D and the other comes from a great idea. The enterprise whom we usually talk to, the key challenge is, whom should we talk to? Should we talk to the startup who's got a great idea, can resolve a critical business problem for me, but I'm not too sure if he's going to be around to see the end of it.
Yep.
Will he survive? Will he get his fund? Will he get his sustenance? And on the other end, the OEM is coming and is somewhere between a very expensive or not reachable for me, and that technology itself is changing. The enterprise is beginning to prefer, as Mr. Acharya is saying, a single window which protects them against the longevity of the startup and that idea as a value coming about, with the power of the large organization into a single window. So as Kishore was saying, Polycom, Cisco, coming in the very small 12 people organization who have a great idea on video analytics. We have a bank where we are getting rid of security guards by giving them a surveillance solution. The bank came up with this idea. The bank brought the startup to us and said, this guy has a great idea, talk to him. We put it together, we evaluated his support process, we found him to a very reasonable organization. We of course de-risked our arrangement with him. And they don't have security guards, 30,000 rupees, 30,000 rupees per month, 400 ATMs, 1.5 crores per month is what they spend on security guards. It's been brought down to about 25 lakhs per month. That's where I think Airtel's challenge is. We are of course to quite an extent continuously living up to that expectation, where we are becoming a single window, bringing hosted applications, high-end technology and startup technology into a single window, acting as a single point of responsibility.
One small angle which again bothers to investors like you or industry leaders like you is the technology obsolescence. Technology changes so fast that your investment goes for waste. It happens very, very often. Like to quote my own example of Airtel, we already have 3 different types of video bridges in our organization. One bridge was invested say 4 years back, and it offers 100 features. There's a 100-second feature, first feature, which is now required by my customer. What do I do? But I'm a service provider. I still have to invest, go ahead and do another bridge which will give me 10 more features, right? Think about this over-the-top companies which have come in, a web, say WhatsApp, Viber, you name it, Google Talk or any of these organizations, they want to give you voice free. Now, if that becomes omnipresent and everybody starts using it, telco's business model is gone for a toss, and we unfortunately have invested 2 lakh crores in last 10 years in this setup, you know, and our primary source of revenue remains voice, right?
So you have to regulate technology.
Exciting for the customer.
On that one, that was actually my last question to you, in the sense that how does Airtel drink their own champagne? What do you do? How do you manage business inside? On that note, ladies and gentlemen, thank you so much for your time. It's been fantastic talking to you for the last 1 hour as to how you're managing efficiencies, how you're managing people more importantly, and of course, most critically, how are you bringing both of them together to ensure that your organization is still well greased and is, going forward irrespective of the challenges and, the roadblocks and hurdles that may come along. Thank you so much for your time. Please join us for cocktails and dinner. Thank you. Thank you.
Thank you.